Hello, this is Josh McCown doing my ankle injury assessment for ROP Sports Medicine following the HOPS procedure, history, observation, palpation, and special test. First, history. We'll start with the questions and start with pastime activities. First thing I might ask the patient is, what is their job? What do they do for a living? At their job, do they sit all day? Are they standing? Are they walking? What are their hobbies? Do they play any sports that involve running? Things like that. Next we'll move on to the primary complaint and start asking them to rate their pain on a scale from 1 to 10, and then ask them to point to the pain specifically. After that, ask them how often the pain occurs, maybe how long the pain lasts, and maybe what makes the pain worse. Next is the mechanism of injury, just trying to find out how this happened. So start off asking them, what were you doing when you first experienced pain? Maybe what were you doing when you noticed the injury? Ask them what type of surface they were on when the injury occurred. You ask them what type of shoes they were wearing. You can also ask them if it was something that it was sudden, from like a direct blow, or it happened over time. And next we'll move on to characteristics. Ask the patient to describe their pain. Ask them if it's a burning sensation, if it's tingling, if it's numb, if there's any bruising, any swelling, if it hurts more standing, questions like that. Next is limitations. Find out what they can and cannot do. Ask questions like, can they go up and down the stairs? Can they walk without a limp? Can they point their toes up? Can they point their toes down? Can they run? Can they even put pressure on the foot at all? And last is past history. Ask them if they've ever had this pain before, if they've ever had this injury before. And if they have, you can ask them if they waited the full length of recovery before returning to physical activity, if they followed all the proper steps in recovering. Maybe ask if this has been if this injury has happened previously in the family and who's had it, questions like that. Now we are moving on to observation. Okay, we are moving on to the observation portion of the HOPS procedure. And we're going to start with looking at the anterior portion of the feet, making sure the feet and toes are in line with the rest of the leg, and they look like they are, no problems here. And have the patient take one step forward, take a look at the medial portion of the foot, make sure they have a good arch, their foot isn't that flat, looks good. Take a look at the lateral side for any bruising, swelling, any sort of deformities on that side of the foot, and there aren't any. Next, I'm going to have the patient turn around and look posteriorly. We're going to look at the back of their heel and make sure that it is either aligned straight with the rest of the leg or slightly valgus or turned out, and his ankles look good. And next, I'm going to ask him to stand up on his toes, and you're looking for the ankles to go varus or turn slightly inward, which they did. And lastly, I'm going to ask the patient to take a couple steps. And while he's doing this, I'm looking for equal stride length, proper weight distribution to each foot, and just having it look like a normal walk, maybe not walking without a limp or anything like that. Okay, now we're going to be looking at the patient's foot while they're in the supine position or laying on their back and looking at the top of the foot. We're going to be looking in between the toes, checking for anything, any bunions, any signs of athlete's foot, any type of deformities in the toe, and there seems to be none. Also checking the toenails, making sure there's no ingrown toenails, making sure they all look good. They do. So checking the top of the foot for any deformities, redness, swelling, anything like that. Okay, next we're going to be looking at the foot while the patient is in the prone position or laying on their stomach. And looking at the bottom of the foot, we're going to check for any signs of cracking. Could be indicators of athlete's foot. Once again, checking in between the toes, just observing for for any bad calluses, ulcerations, or plantar warts, and it looks pretty good. We have finished the observation and now going to move on to palpation. Okay, now that we're on to the palpation portion of hops, we're going to start by feeling the medial malleolus, feeling for the tibial nerve, making sure there's no irritation or signs of swelling. Next, we'll move on to the lateral malleolus, feeling for the peroneal tendons. Check in front of and behind the malleolus, checking for any swelling, if there's any type of pain associated, and there's not. Next, we're going to check the posterior side of the ankle, and we're going to feel here, feel on both sides of the Achilles tendon, make sure it's even, there's no deformities, and that there's no pain when pressure is applied. Next, we'll check for the sesamoid, which is the base of the first metatarsal head, right here. There's no pain. Also, check the metatarsal phalangeal joints, making sure there's no pain, no swelling, no irritation. And last, check the plantar fascia, feel the bottom of the foot. Make sure there's no pain associated when you feel the bottom of the foot. And all is good. We'll move on to the special tests. Okay, now we're going to be doing the range of motion tests. We're going to start with dorsiflexion of the patient's foot in neutral position. Have them dorsiflex. And you want that between 15 and 20 degrees. And now back in neutral position, and a plantar flexion. And you want that to be about 40 to 50 degrees. And then next we're going to test the inversion, and that's going to be about 25 to 35 degrees. And last, eversion, and you want that to be about 20 to 25 degrees. Now on to muscle testing. Okay, now we're going to do the muscle testing for the ankle. We're going to start by testing the posterior tibialis, kind of the foot in plantar flexion. I'm going to resist the patient's attempt to invert the foot. Okay, next we're going to do the anterior tibialis. While they're still going to have their foot plantar flexed, and attempt the resistance to invert and dorsiflex at the same time. Okay, next we're going to check for the peroneus longus and brevis. While the foot is in plantar flexion, and attempt the patient's resistance to evert the foot. Okay, and next the extensor hallucis longus and extensors. We're going to have the ankle in neutral position, and we're going to resist the patient's attempt to extend the great toe. And next is the flexor hallucis longus and flexors. And while the ankle is still in neutral position, we're going to resist the patient's attempt to flex the big toe. And last, we're going to check the gastrocnemius. We're going to have the ankle in dorsiflexion and resist the patient's attempt to plantar flex. And those are all the muscle tests. Now moving on to the special. Okay, for this last portion, we are going to be doing the special test. Start with the anterior jaw test. This is to test the talofibular ligament. Hold the leg down. That one is good. Next is the apprehension test. Again, it does the anterior talofibular ligament. And we're going to have here, take the ankle and try to invert the foot. Next is the varus and valgus stress test. Stabilize the leg and attempt to varus, attempt to turn it inward, and valgus outward. Those are both good. Next is the MTP instability test. I'm going to take the big toe, put a finger on this side and try to push in. Put a finger on the outside, try to push out. That's good. And last, we have the interdigital neuroma or Morton's neuroma test. Squeeze the toes together and feel in between the digits here for any bumps or anything like that. That's all the special tests, and that concludes the HOPS procedure.